Hello everyone, my name is Tiara Brooks, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Healthy Minds, Healthy Bodies, Promoting Mental Wellness in Youth. Today's presentation will be presented by the School-Based Health Alliance Youth Advisory Council as they share their perspective on mental health, how SBHCs can promote awareness, and ways adolescents and adults can work together to overcome stigmas and improve student health. But before we begin, we have a few housekeeping reminders. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based health care. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to health care services. School-Based Health Center is the solution, bringing health care to where students already spend the majority of their time in school. When health and education come together, great things happen. Attendance improves. Conditions like asthma or diabetes are better managed. Behavioral health issues get quick expert attention, and we all know that healthy students make better learners. First, please help us with our attendance count. If you are viewing as a group, please go to the chat window in the question box and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. Also, all attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the question box located in your GoToWebinar control window. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archived webinars for topics such as the ones you are viewing on your screen. We are excited to announce the Be the Change Youth Training Program taking place during the 2016 National School-Based Healthcare Convention and Rally in Arlington, Virginia. The Be the Change Youth Training Program is an opportunity for youth to learn about and discuss health and education topics, develop advocacy and leadership skills, and have fun. Be the Change participants will network with each other and school-based healthcare advocates at the convention and participate in various workshops pertaining to health and education, policy, and school-based health centers. Best of all, there are scholarships available to assist youth with registration and hotel accommodations. Please find more information on Be the Change, including program details, previous participant reflections, and how to register on our website at sbhforall.org/convention/youth program. This is also attached in your handout section on your GoToWebinar control panel. I would now like to introduce our presenters today. First, Nathaniel is a senior at Woodlawn High School from Baton Rouge, Louisiana. He is a part of 3 different youth-led health organizations: School-Based Health Alliance Youth Advisory Council, the Students Alliance Council, and the Health Advisory Council, which he created at his school. Upon graduation, Nate will be entering the Marine Corps. Nicole is from Omaha, Nebraska, and currently is a senior at Omaha Northwest High School. She is very involved in her school and community and participates in clubs like National Honor Society, Student Council, Thrive, Healthy Huskies, and Loves to Volunteer. Nicole will be attending Southern Adventist University, majoring in International Business and Administration. Anna graduated from Stanford. Anna is seeking to use her background in biology, human-centered design, and education to promote child and adolescent health in creative and innovative ways. She is now serving a term as an AmeriCorps member in Ultimate, Southern California's premier network of community health centers, where she works on policy, environmental, and systemic approaches to obesity and chronic disease prevention in Southeast Los Angeles. Cameron. Cameron is a senior at Roswell High School in Roswell, New Mexico, and is in her second year being on School-Based Health Alliance Youth Advisory Council. She is the founder and president of a nonprofit called Impact Teams, which is a group of young women who strive to improve their community and school by raising awareness about different health issues, and is sponsored by the School-Based Health Center in Roswell High School. She will be attending Texas Christian University, majoring in engineering. But before we get started with our presenters, we do have a poll question for you. Our first question is, does your SBHC, Health Center, Department, Organization have a Youth Advisory Council? If you can please just take a few seconds to answer the question. Thank you. All right, thank you, everyone. As you can see, 66% said no, 22% said yes, and 12% is in the works, and that's quite all right. We would now like to turn it over to our first presenter, Cameron.
Hi, everyone. My name is Cameron, and welcome to our webinar. We're very excited to have you today. Before we start, just our presentation is called Healthy Minds, Healthy Lives. We are going to start off this presentation with a video. Okay.
We apologize, everyone. We're just having a few technical difficulties, but it's coming up momentarily. All right, Cameron, it's all you.
All right. Okay. So the video is going to play now.
Wow, he looks so confident. He do that without hesitating at all. Art clip sounds interesting. It'd be great to meet someone who likes art. I do. Wait, no. I can't sign up for this, no one would like me and I won't have anyone to talk to. I'll still be alone. I just want to go home. I really don't want to go to class.
Oh, please, look as slow as you possibly can. Thank you. Very helpful. Ugh, she's so pretty. How many people think she's prettier than me? She so knows she's pretty. Okay, focus. Like all self-control and eating a bagel with cream cheese today really set me back. Ugh, I hate my life. So gross. 300 calories left today? It's fine. I'll just skip lunch. No big deal. Gross. Guys are just gross. He's probably looking to use third Snickers bar today with zero consequence. I'm so jealous. Wow, only 400 calories left for the day. It's not even lunch yet. Way to go, Brad. You're right. I'll always be just a kid, no matter how much I lose. I just have to get skipping lunch today. Okay, but seriously, I might pass out again if I get a cheer practice without eating. Maybe the stupid vending machine will have something that's not entirely genetically modified. Thanks, Mrs. Obama. Whatever. Yeah, no. Like I'm putting anything with that much corn syrup anywhere near my mouth. It's fine. Maybe I'll be light enough to do something other than a baby at first. Why are all the cheerleaders so pretty in this school? I would give anything to trick live Luther for a day. Maybe Pop Boy will actually be in class today and talk to me. I wish I didn't always feel so alone.
I don't understand this stupid class and what difference does it make anyway. The teacher and my parents don't understand me. They don't even try.
I was hoping you might be here today. Our class without a friend. Father is pretty boring. Are you even listening to me?
If you do answer me, I will stay with you. I don't want to talk about it. Just leave me alone.
You think you are the only one who's approving? Okay, whatever.
Well, as you guys can see by that video, mental health is a very broad topic and it's multifaceted with multiple different aspects to it. Here are some questions and answers to have a better understanding and to have a base to start off this presentation. To begin, what is mental health? A mental health illness is a disorder. It is an illness. Like any other health problem, it is something that we cannot control. And it affects thinking, mood, behavior, ability to relate to others, and to function on a daily basis. Everyone handles this differently, and side effects are different between everyone. Now, why is this important to youth? As you can see from this beautiful graphic given by Urban Design Mental Health, 1 in 4 are affected by mental illness. This is either they have it themselves, they are undiagnosed, or family or friend or close friend has a mental illness. 8.6 million adults have suicidal thoughts. Usually this stems from usually this starts as youth. Suicide is the 3rd leading cause of death. That's in adult and youth. children with anxiety disorders are the least likely to receive treatment. People of color are less likely to have access to care. And out of everyone, 1 in 30 experience PTSD. As you can see, this affects everyone at least at some level. Now, what are the stigmas or misconceptions? First off, is it is not a choice or failing. It is an illness. You'd never say, it's just cancer, get over it. That's exactly how it is about any mental health. We do not understand it, and, well, most people don't understand it, but that doesn't mean that they deserve a stigma. It's a very complex illness, and it is different for everyone. It's best to keep an open mind and to ask questions and to always be open to whatever answers that may come from it. And to remember that everyone takes it differently, even if they have the same diagnosis. What are the impacts of mental health issues? One of the first things is sleeping and eating patterns. This is one of the most visible signs of a mental health issue. Sleeping more, sleeping less, eating more, eating less. But then again, everything's different for every person. Ability to relate to others. This can really harm relationships and can deteriorate friendships, bonds between parents, bonds between siblings. Sometimes people become withdrawn or they lash out. School performance definitely is impacted with the no one wants to go to school, no one wants to be around, other people. They don't eat, they don't sleep, they can't focus when they are in school. And self-harm and suicide are the most dangerous of all the impacts of mental health issues. Now, what are the policies being made to make a difference in mental health? Right now, there's roughly 220 bills this year in Congress concerning mental health, including the Hallways to Health bill. Hallways to Health is a bill that supports SBHCs. Is meant to expand and provide primary care and behavioral health services. Many times, students do not receive behavioral health and never get a diagnosis. Being left untreated can lead to a person feeling alone and not having help, not understanding what's happening to them. Diagnosis and professional help is very, very important, and Hallways to Health is a bill that will certainly help with this. And I've given you a broad, just basic background to start off this presentation. My colleague Nicole here will give you a deeper dive into mental health and the effects and what it is.
All right, thank you. We do have another poll question for you. What are the top 2 mental health disorders among adolescents? If you could please take a few seconds to answer the question. Thank you. All right, thank you, everyone. It shows, wow, 75% depression and anxiety. All right, and we have 13% anxiety eating disorder, 10% ADHD, and 1% eating disorder and ADHD. All right, thank you, everyone. We'll now like to switch it over to our presenter, Nicole.
Hello, everyone. Thank you, Cameron, for speaking about what exactly mental health disorders are. So I'm going to talk a little bit about anxiety and depression, which, as 75% of you answered correctly, are the 2 main mental health disorders that affect teens. And so anxiety is a distress or uneasiness of mind caused by fear or danger of misfortune. And then depression is a condition of general emotional rejection and withdrawal sadness greater and more prolonged than warranted by any objective reason. And so it's just really good to see the difference between both of those because they're usually grouped together. So on to speaking about depression. So approximately 20% of teens experience depression before they reach adulthood, and then 70% of those are untreated. And so then, who is most likely to suffer from depression? Whenever we think about this, we think of the substance abusers, the abuse and neglect victims, children from broken homes, and those that have extreme circumstances as far as chronic illnesses or physical disorders, or just something that we can perceive on the outside to seem like that might be a reason people have depression, especially teens. But we forget about those high-achieving students, the ones that excel academically and athletically. And unfortunately, those are the ones that we almost see them as perfect beings that are not affected by anything. You know, nothing can really faze them. They're the ones that we go to when we need to get things done. They're the ones that we know we can always count on. And unfortunately, after we we rely on them so much, and they excel in so many different things, that as soon as they stop excelling, they might find some kind of roadblock. They fail at whatever thing. It might not even be that big, but then their bubble bursts and they realize that they're not perfect and they have to find some way to deal with that. And unfortunately, that does lead into depression. And so San Diego State University did a study, and they found that 5 times as many high school and college students are dealing with anxiety and other mental health issues as youth of the same age who were studied in the Great Depression era. So again, just kind of the change of the kind of things that we have, the narcissism, the cultural changes, the changes of just the household themselves, school, all of these kind of things have resulted in this. So then what are the symptoms? Hopelessness, sadness, irritability, frustration, change in performance in areas where they had excelled, as mentioned previously, agitation, insomnia. They often feel very guilty for things that they might not have any reason to feel guilty for, but they just feel guilty because they aren't perfect and something is going wrong in their lives, and they can't find how to cope with it, and so they just they withdraw within themselves and they stop talking to people. They become antisocial. So then on to anxiety. So depression and anxiety are very similar disorders, but they also are very different. So again, the nervousness, irritability, and problem sleeping, those are similar symptoms. And so then the Anxiety and Depression Association of America estimates that 1 out of 5 people has an anxiety disorder. And then this is the most common mental disorder in the U.S. as a whole. This is not even just talking about teens. As a whole, this is the most common mental disorder. And so then again, since the symptoms are so similar, we often group them together. But anxiety is very focused on the worry, the fear. You're uneasy. You don't know what's going to happen in the future. You feel like you're uncertain. The uncertainty just kind of really just gets to you. Often your body reacts in a way where you feel sick. So you might actually have a stomach ache because you're so anxious. You can get headaches because you're so anxious. You often, your body just feels very sore. And so those are just the physical aspects, but you just lose interest in your school. You avoid populated places. You neglect very often a lot of your responsibilities. And yeah, so then one has to wonder why are all of these changes occurring? So then again, instead of the 1 out of 5, here you have 25% of teens suffer from anxiety. So 1 out of 4 teens, that is not good. And so then 30% of all teen girls fall into this anxiety trap. And so then we have to wonder, why are all these things happening? What has changed so much? Narcissism, just our culture and the cultural changes. We do not have the same kind of society, the same kind of culture that we had 20 years ago, even 10 years ago. So many things have changed. And again, the high academic expectations, the students that we don't perceive as being vulnerable to the anxiety, to the depression. Every year we ask of students, we ask more and more and more of students. We ask them to take those AP courses. We ask them to take those honor classes. We ask them to be involved in national societies, student council, key club. We ask them to be a part of all of these different things. And we don't realize that we're actually tearing them down, and we're just we're putting them out into different areas where they can't just focus on one thing, which leads to this anxiety. Again, just the unstableness of the home, the parental divorce, and then in our culture, drugs and alcohol just being more prevalent and more easily available to teens of all ages. And so people with anxiety disorders are 3 to 5 times more likely to go to the doctor and 6 times more likely to be hospitalized for psychiatric disorders. And here in Omaha, we have identified this as a big problem, and so I am actually a part of the Omaha Thrive Club, and this is a servant leadership club. We focus on preparing teens for the future. This is funded by the Migrant Education Program of Omaha Public Schools. We are in 5 different high schools, and we meet for 2 hours after school, 1 day out of the week, where we just discuss ways that we can better serve our community and ways that we can better ourselves to better help the community. Every year, we choose a service learning project. Again, one of our main focuses is helping the community, and in the previous years, we've done tutoring for ESL students. We have done, we adopted a family from Burma, and then this year, we decided to focus on mental health. So we focused on the 3 mental health areas: anxiety, depression, and eating disorders. And we actually filmed the video that you watched at the beginning of this presentation. That was all directed, produced, and filmed by students with the help of an organization here in town that helped to just provide the cameras and the equipment to help film. And so, unfortunately, we work with a lot of, fortunately, we work with a lot of migrant students that might not otherwise have the opportunity to be in leadership positions. But unfortunately, in a lot of these cultures, mental health is not something that is addressed. I am from a Hispanic background, and in my family, or at least as far as I know in our culture, it's not something that we talk about. If you think you're going through something like a depression or anxiety, it's easily swept under the rug. You don't talk about it until you compose yourself, you fix your life, and then you just go on having a good day. And unfortunately, it doesn't always work that way. That's not how as these things are fixed. As Cameron said, you don't just tell someone with cancer to just, just get over it. It's not a big deal. No, this is a very big deal. And so we decided what's a really good way to reach out to the community, and so we decided to do a video. And so we also went to the other 4 high schools, and we did a presentation where we empowered the youth, we gave them the tools to actually be able to work with their friends and work with their teachers and just be able to help them identify the signs of having this anxiety, depression, and eating disorders. And we also have business cards that had the suicide helpline number on there, as well as the depression, which is the same number. And we told them that even though they might not need it today, they might not even need it tomorrow, they might not need it next week, we asked them to put that card in their wallet or someplace that they would always have it with them in case they needed it. And we even helped them find ways for them to be able to address it with their friends, and we also gave them cards to give to their friends. We want to be able to reach out to a majority of the teens and just let them know that if they're going through some of this, they're not alone. And so we have to really focus on what we can do to help prevent teens from getting to that point where they just feel like they have no other choice but to go, en route to suicide. So I will pass this along to Nate. Thank you so much for your time, and he will talk about prevention. So thank you so much.
All right, thank you so much. And right before we start with Nate, we do have another poll question. What is a positive method for coping with a mental health disorder? If you can please take a few seconds to answer the question. Thank you. All right, great. Thank you, everyone. So we have 98% that said all the above. Thank you again for answering this whole question. Nate, I'll turn it over to you.
Hi, you guys. Thank you for joining us today. My name is Nathaniel Baptiste, and I will be talking on prevention. First, I want to start off with taking action through prevention. Earlier identification and interventions turn out better outcomes, but also prevention works as well. Prevention is equally important for two reasons: for yourself, to reduce or avoid the negative impact of stresses, and as Nicole said, and for others to promote positive outlooks on mental health and mental disorders. And some of the ways that we can do that is to focus on protective factors. Next slide, please. Hello?
Okay, yes, it says, what is protective factors slide?
Yes. Oh, it's okay. Yes, ma'am. Can please switch that one? I don't know if there's something happening. But what is a protective factor? Protective factors are strong family and social supports and the mutual ability of youth and children to adapt to new situations, which means that they really have to have a strong community, strong friends, and people around them to help them cope with moving to new places, experiencing new things, and just having an all-around new environment that they're not used to, and that could cause so much to them. But some protective factors are healthy practices, good self-esteem, good problem-solving skills, parental and family support, and community bonding. If you guys could switch to the next slide. There we go. Who can focus on prevention? Everybody can focus on prevention. Healthcare centers, parents, students, faculty, community members, it really doesn't matter who. As long as they have a positive intention with it, they can do it. And I'm from Baton Rouge, Louisiana, which we have school-based health centers, but we don't have a lot of them out here. And so it's really hard to find that one place for students, for them to go where they can have a safe environment where they can have group therapy. They can have, as the poll question said. But one of my clubs that I'm involved in, we did a project on mental health, and it was with this student who has autism. And so we have walked around and we did many different things. We talked to students, we passed out we talked to students in faculty, we have informative flyers and pamphlets, and we have pre and post tests that we had them take. And our goal was to inform students and community to promote positive attitudes, prevent stigmas, because it's not only for the individuals, but also in groups and communities where there are many different health disorders known, and we don't know the causes of it, and there are some we do. But it just depends on how you focus on it. But our goal of the event was to inform students and communities to promote positive attitudes, prevent stigmas, and every time we talked to students, we always made sure that we went in the morning and at lunchtime. We made sure that they understood. We made sure that we was really getting through to them. We made sure that we put flyers in teachers' mailboxes. We made sure that we handed them out in classrooms. We made sure that every time they took a pre-test and a post-test that they actually got something out of us instead of them just staring us in the face till they went blue. And every time they had a question that we couldn't answer, we always directed them to our nurse, Aya, which is a wonderful woman. We always made sure that we got to the point, but always having enough time for them to have their questions, because not everyone's going to get it. Next slide, please. Mental health is a very important topic. You can be born with a mental illness, or you can develop one. For example, I'm a child of divorce, which means there are other kids like me, and that could be very traumatic for a young kid to have to watch his parents divorce, not knowing whether he's going to see both his parents, or not really knowing the whole situation. So that could cause so much to a young kid that it really affects him mentally. And it's really important for not only the child, but people around the child to know of mental illness and why it's important. And that's what we try to focus on. Mental illness is what we plan to do from our events. We plan to make sure that we talk to more students. We go through the community just a little bit more. We plan to get guest speakers out, and we plan to get those who are willing with mental disorders to come out to the schools and talk with the students. Maybe during a pep rap, not a pep rap, event, maybe we can get the classes out, anything that helps our case. You guys can go to the next slide for me.
Okay, well, we have a poll question at the moment. Are you a trusted adult in a young person's life? If you can please take a few seconds to answer the question. Thank you, everyone. All right, 100% said yes, that you are a trusted adult in a young person's life. All right, Nate, if you wanted to add a few more things after this. All right. And then if not, we can transition over to Cameron whenever you're ready. To Anna whenever you're ready.
Hi everyone, my name is Anna Casalme and my section is going to be on intervention or mental health promotion beyond diagnosis. So to start off, I wanted to highlight some interventions that I personally am familiar with. Next slide, please. So I wanted to start off with the school mental health program with LAUSD. I'm from Southern California, and a lot of the schools that we work with have school mental health clinics, which is part of LAUSD's school mental health program, which seeks to promote the mental health, well-being, and academic achievement of all LAUSD students. So as you can see, it's all throughout LA County, and the school mental health professionals that the bottom left refers to are psychiatric social workers. And what I really want to highlight is their tiered system of approach to support, which is comprehensive and takes into account prevention at the universal level and creating a greater culture of mental health. And as you can see, as the levels go up, it becomes more and more narrow from strategic to intensive. So as you screen and create or identify groups that are at risk, and then from there identify individuals who are in need of greater support and greater care, and creating teams for those students. So this is just one model, but I know there are plenty throughout the country, and I personally would love to learn more about them if anybody wants to share them. But the other slide that I wanted to talk about was on partnerships. So from my work with schools, I can definitely see how we can kind of burden our schools with addressing all of these issues that youth face today, whether it be the achievement gap or school violence. We ask schools to do a lot in order to help us combat these issues. So I wanted to highlight Alameda County Center for Healthy Schools and Communities and their utilizations of partnerships. This one in particular I find creative and compelling and very context specific. So this partnership is between the center and Beats, Rhymes, and Life. BRL is a nonprofit organization that seeks to use hip-hop as a medium for therapy in areas that are urban and are affected by violence. So this partnership ideally would lead to these outcomes, which address the protective factors that Nate just mentioned earlier, which includes self-esteem, school performance and attendance, positive coping strategies, and fostering and strengthening relationships between peers and their community. Lastly, I wanted to talk about youth engagement and how that can play a role in mental health promotion in schools. So this is, again, with Alameda County School-Based Health Centers, and this is their YA Peer Education Program, YA standing for Youth Educating and Advocating for Health. So pictured are these wonderful students from Alameda High School and Ensenada High School who spend their year giving presentations to their fellow students about anything from stress to body image. And not only that, they raise awareness of these issues, but also connect their students and their peers to the support groups that are held at the school-based health centers. Because if students, it doesn't matter if you have these resources and services available, if students don't utilize them, how effective can they really be? So I think this is such a great way to increase youth engagement with any mental health services that are currently available. So even if you do not have a youth advisor council or partnerships with organizations like BRL or even a comprehensive district-wide school mental health program, as we mentioned in the poll question, what really matters is the individual interactions and having someone to talk to. That is the basis of mental health for youth, is just having that person there. So this is a great website, youthvoices.gov, and these are some videos of students talking about the impact that their counselor at their school has had on them. So we're not going to watch any of the videos today, but in particular, Cameron, age 13, wrote an essay about how his life has been impacted by meeting with his counselor weekly. And as you can see, his grades have gotten better. He feels much more stable and is just a lot happier in general. Continuing in that vein, I wanted to share a more personal story of the impact that someone had on my mental health. So this is Dr. Larry Zaroff. He was my major advisor at Stanford in the human biology program. And Dr. Zaroff's main responsibilities was to approve my course schedule, make sure I was on track to graduate, but he went beyond that. He saw that I wasn't sleeping very well. He saw that I wasn't doing as well as he knew I could in classes that I really loved. And through that, we realized that I had been living with undiagnosed PTSD for a few years. And Dr. Zaroff is really the person who asked the questions that needed to be asked in order for me to start seeking care. And he's the person who referred me to my college's health center and also followed up with me to make sure that I went to my appointment, especially since for the first few months I definitely did not show up. So I'm very grateful to the impact that he had on my life, and I hope that as professionals who work with youth, you also are able to have that impact on someone else. So with that, what can you do to help? And as a trusted adult, which you all are according to this poll, always be able to offer support and positive feedback, encourage positive relationships, and with that, also keeping an eye out for relationships that are not so positive, whether it be a parent or a boyfriend or a girlfriend who might be negatively affecting the youth. Promoting good sleep, which I know I definitely struggled with in high school. Being mindful of screen time, and that also includes social media and how that affects young people. Doing your research, so attending webinars like this is such a great first step, but also connecting with the mental health resources that we have in our handouts section on this GoToWebinar. Encouraging a young person to get treatment early and also taking care of yourself, which Cameron will talk about later. But on the left, I wanted to briefly go over what not to say to a teenager that you suspect or may actually have depression. And so these sayings, there are people worse off than you, it's just stress or hormones, don't be so dramatic. I think they capture this sentiment that adolescents are overreacting, and these tend to undermine what adolescents are going through and how exactly they feel. And even if we know that and we are reminded of that, it's important to always keep at the forefront that, you know, even if it doesn't seem like a big problem to us personally, to remember that to a teenager it might actually seem like a lot, and that doesn't make their emotions or feelings any less valid. So with that, I'm going to turn it over to Cameron. Thank you.
Well, nice to talk to you guys again. Before I begin, I would like to apologize. My dogs won't stop barking, so if you hear them, I'm really sorry. So, like she said, if you are influencing someone's life, or if you have a job, if you have children, if husband, wife, anything, or even if you are just yourself, there's things you can do to help yourself for the betterment of you and everyone around you. So first, you need to make time for 5 things. Number 1, yourself, making sure you go out and you do things that make you happy. Watching your favorite TV show every once in a while, wearing that T-shirt that makes you really happy. Another thing is your relationships. take time for your brother, your sister, your aunt, your uncle, your mom, your dad, people who are very important to you and make you happy. Another thing is to take time for your spiritual life. If you're Christian, go to church. If you're pagan, sit outside in nature. If you do whatever makes you happy and what brings you greatest joy spiritually. Another thing is make time for work and school. If you're a student, study. If you go to work, make sure you're not late every day. Make sure you're organized. And another very important thing that all of us forget is physical health. Make sure you eat right. Make sure you go running or do some sort of workout. You need to be the best you so you can help others. Another thing is mindfulness. Mindfulness is a state of active, open attention to the present. So there's intentional and unintentional. Intentional is you are focused on something. Unintentional is if someone were to slam open the door and rush into your room at that moment. At that moment, all your attention would turn towards them. Intentional is the one that we often forget about, and it's very important to teach others and to practice yourself. This is taking a moment, realizing what's happening, reflecting, having a plan before you act out and do what you're going to do. Having a plan is always great, and being intentional with your thoughts and your actions. So to come full circle, here are some important takeaways. Mental health is just health. It's something that people deal with, and it's different for everyone. It is not a choice or a moral failing. This is just health. Another thing is you are not your disorder. Just because you have anxiety does not mean that you're worry wart. You're more than that. You are a person who can do things and can get over it. Another thing is professional diagnosis is essential. Being left undiagnosed can lead to people not understanding what's happening to them, and also to people not knowing what to do next, how to take care of it. And this is very important if you do recognize the signs for people to refer them to professional help. And this is where school-based health centers can come in and giving that behavioral help. Thank you guys so much for everything today and coming to our webinar and listening to us. We're very thankful for each and every one of you, and we all hope that this was a great time for you. On behalf of the whole Youth Advisory Council, I want to say thank you, and I believe this is the end of our webinar.
All right, thank you so much to our guests. We'd like to let you know if you have any questions, please enter your questions in the chat box on the control window. Please enter your questions now, and while we give everyone the opportunity to enter their questions, we will like to mention for anyone who'd like to become a member, while you enter your questions, the School-Based Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based health care. Our members extend and support our work. Trainings like this webinar would not be possible without the support of our members. So we ask you to please log on to SBH4All/membership for more information, and please join us. Also, we'd like to mention our mental health and first aid training that we will be having at our convention this year on June 26th as part of our pre-conference all-day training. We also have attached this form onto the handout section of the GoToWebinar control window if you'd like to print this off and submit the form. We ask that you please join our pre-conference this year. If you have any questions, again, please email us and go onto our website. We'll be happy to assist you. All right, we do have a question. So if our YAC members can just answer, have you seen progress within your schools after presenting on various mental health topics? Are students about more helping each other? So what do you guys think?
Well, personally, and this is, oh, sorry, Nate.
No, you can go, Cameron.
Okay. Well, this is Cameron, guys, and personally, at least in my school, once we started advocating and speaking to people about different health issues and getting things out there, I saw that so many people were ready to jump in and getting involved. I think education definitely sparks a lot of action afterwards. I remember after our first presentation for my impact group, our attendance in our meetings about doubled because so many people were like amazed at what they didn't know before, and so many people wanted to learn so much more, and people wanted to help. And so I think definitely telling about it and talking about it can spark a lot of people to do something about it.
All right, Nate, did you want to add anything?
I was just going to add, making sure that everyone is well educated on it is the biggest factor. If they're not educated on it, then you'll see that most people really don't care about it.
I also wanted to add that I do presentations at all girls high schools on sexual assault, consent, and the mental health effects that go with being sexually assaulted. And it's a difficult topic, but it's so important, especially among these populations, to talk about it, because there's literally no one else who is willing to come into these schools and talk to these girls about things that are very potentially uncomfortable. And just seeing that these students are continuing to talk about it very openly and look for resources, and also be aware of how they discuss these kinds of issues has been very encouraging for me personally.
Thank you so much. Our next question is, how do you get a youth advocacy council started in their area?
That's funny.
Sorry, Nate, you keep doing this. You go first. I know you know a lot more about this.
That's so funny because my organization in Baton Rouge, we actually did a presentation on starting a youth organization within the school-based health centers last year at convention. But the most important thing is really making sure the youth is well motivated and it's youth led. If you put the youth in charge, they will show you how hard they will work for anything.
I'm going to add on to that in saying, oh, Cameron, by the way, definitely reaching out to other organizations that already exist. I know, like with Nicole, she partnered up with her student council. I partnered up with the school-based health center. I've also worked with Enlace, which is engaging Latino youth, or it's something along those lines. It's some acronym, but definitely working with organizations that already exist to ask for their advice and their help, and what resources they have definitely helps kickstart your own project.
This is Nicole. I'm just going to go ahead and just kind of, I'm going to agree with Nate and Cameron. You definitely have to, at least the council that we have here, it's very much youth-led and peer-driven. So, I mean, like Nate said, if you put the youth in charge, they're the ones that they can show you just exactly what they can do. And then as Cameron said, you just have to find a way to make it sustainable. That's something that we had a huge problem with last year, the first year that we started our council, is that we just tried to bring in this entirely new council into the school without having any other kind of help and our numbers dwindled a little bit. And so then this year what we decided to do was embed it in an organization that was already thriving and successful in our school, which was the student council. And so we just have our own little committee, and then we have a lot more resources and a lot more people at our disposal. And so again, just kind of just restating what Cameron and Nate both said. You definitely have to have the youth involved, and you definitely have to find a way to make it sustainable within your school, within your community, whatever it is you want to start it.
Great, thank you so much. We are at the top of the hour, so any questions that we're not able to get to, we'll definitely respond to you via email. We do want to again remind everyone about the Be the Change Youth Training Program. If you can please visit our website, SBH4All/convention/youth program. And our YAC group will be there. If you want to meet our presenters in person, they will be there at our convention. So again, if you can visit our website for more information, you can print this off. It is attached in your handout in your go-to control window panel. We do have a few more poll questions that we have for everyone, just a few more. All right, so we would like to know, did this presentation meet your needs? If you can please just take a few seconds to answer the question. Okay, and our next question is, would you recommend this webinar to others? And just a reminder, this webinar is being recorded and will be uploaded on our website in 3 to 5 business days. All right, and our next question is, how well did the presentation meet the stated objectives? Okay, and our final poll question is, how likely are you to apply information from this presentation within your organization? Okay, thank you everyone. And again, a sincere thank you to our YAC members, Nate, Nicole, Anna, and Cameron. We thank you again for this amazing presentation, and we hope that everyone will have a wonderful day.